And when they offered me LTAC, I immediately thought of it as like a nursing home. So sabi ko, parang nursing home ito, so baka madali lang yung work. But I was wrong. This is not an easy job. Hello everyone! Welcome back to my channel. This is your nurse GMAT. Kumusta po? Today we're gonna talk about LTAC. So since I work in LTAC, and then para magkaroon din kayo ng idea of what LTAC is, I don't remember kung naituro ito sa nursing school. I don't remember anything na na-mention yung LTAC. So usually sa nursing, ang minimension nila is acute hospitals, occasionally mga nursing homes na may mention, but LTAC, ano nga ba yung LTAC? And when they offered me LTAC, I immediately thought of it as like a nursing home. So sabi ko, parang nursing home ito, so baka madali lang yung work. But I was wrong. This is not an easy job. So for those na interesado kung interesado mag-work in an LTAC facility, hope magkaroon kayo ng idea of what is LTAC and ano ba yung mga ginagawa namin sa LTAC. But before that, guys, please subscribe to my channel. Please like this video if you like it, and click the notification bell. Anyway, I also have my Instagram page, Nurse GMAT US, Twitter, Nurse GMAT US, and Facebook, of course, Nurse GMAT. So, sana i-add nyo ako, please! The most frequently asked questions about LTAC. So long-term acute care or long-term acute care hospital. So, number one question, what is LTAC? So yung LTAC, it's like a step down from ICU, but don't get me wrong, in our facility we also have the special care unit. These are basically ICU patients too na kailangan ng close monitoring. Usually, ang mga pasyente sa LTAC is yung mga prolonged yung weaning. Ito talaga yung pinaka-primary na makikita mo sa mga LTAC. Yung mga pasyente na nagre-require ng weaning. Pag sinabing weaning, yung naka-ventilator yung pasyente, from ventilator, tawag nito, tulungan natin yung pasyente na maibalik yung normal na oxygenation niya. Yung as much as possible, maibalik na makahinga siya on his own or on her own, diba? So usually the weaning process starts from mechanical ventilator, and then yung TPs na nakalagay sa ET tube, tapos i-connect yan sa oxygen, kung ilang percent man yung kailangan ng pasyente. Usually ang makikita yung patient sa LTAC is naka-trach yan. Yung very common setup ng pasyente sa LTAC is naka-trach collar, and then naka-peg tube. Peg tube yan. Usually may mga wounds din yan. So that brings us to the number 2 question. What types of patients are seen in an LTAC? So eto nga. Number 1, patients who require a prolonged ventilator or weaning. Patients with an ongoing dialysis for chronic renal failure, intensive respiratory care, multiple IV medications or transfusions. So sa amin, meron kami mga drips din. We have, pag naka-intubate yung pasyente, parang protocol na lagyan ng Presidex drip. So we also do Presidex drip, but most commonly Propofol. Ayan, Propofol, and then we also, of course, we have the pressors like Levophed, yeah, Levophed Drip, dopamine drip. We also have Heparin Drip, amiodarone drip. So very common din yan sa amin. And then complex wound care and care for burns. So yeah, one thing din sa amin is wound care. So marami sa amin yung mga pasyente na for may mga bed sores, yung mga nag-underwent ng mga abdominal surgeries. Marami kami mga ganyan, very common yan. Yung mga pasyente na naka-TPN dahil nga hindi pwede ni oral feeding. Meron kaming wound care team na like every day ginagawa yung wound dressing ng mga patients. But since I'm a night nurse, syempre kapag ang order is twice daily, usually yung wound care team is lang sila, office hours. So pag twice daily, so we're obligated to do the wound dressing too. Time consuming din yung wound dressing sometimes, lalo kung malalaki yung mga sugat. Especially kung malalaki din yung mga pasyente. So kailangan mo ng help din. So those are the common patients na makikita nyo sa LTAC. Kumbaga, they need specialized care. Isipin nyo parating naka-vent yung mga pasyente dyan, naka-tube feeding yung mga pasyente dyan, may mga wound for wound management or antibiotic therapy for dialysis, peritoneal or hemodialysis. Yun yung pinaka-basic talaga na patients na makikita nyo sa LTAC. Number 3 question, where is LTAC located? So ayun, yung LTAC, yung pinag-workan ko LTAC is a standalone facility. Other LTACs is nasa housed within an acute care hospital. So sa isang acute care hospital, pwede din merong LTAC doon, but function independently. Okay? Number 4 question is, how is LTAC different from traditional hospital? So the biggest difference is in specialization. Meron lang kaming specific na pasyente na tinatanggap. So hindi naman lahat na cases is tinatanggap ng LTAC. So basically yung mga patient na matagal na nga sa ICU, na hindi ma-win-win from the ventilator. So nililipat nila yan sa LTAC para mas kasi may respiratory team na nag-handle specially para mapadali yung weaning process ng mga patients natin, okay? Yung setup namin is, right now, we're like 50 bed capacity. So, meron kaming regular rooms, and then some of the rooms, may tinatawag kami na blue zones. Yun yung medyo kailangan ng frequent monitoring, like every 2 hours. Sila yung mga rooms na may mga cardiac monitor na automatic nag-check ng mga vital signs ng mga pasyente. Like 6 or 7 rooms for the blue zones. And then, yung special care unit nga namin, yung talagang pinaka-ICU namin is 4 bedroom yon. So usually dalawang nurse doon. But it depends din ng patient's acuity, no? Kapag sobrang malala, syempre 1:1. We don't have emergency room. Walang maternity ward, so we don't deal with pregnant people. Wala rin kaming outpatient. And here's the thing that I'm sure not all LTACs, but in our LTAC we don't have a laboratory. Kami pala kumukuha ng mga ng mga specimens. So kami yung gumagawa ng blood extraction for the patient. Wala kaming medtech. So kami yung gumagawa noon, and then may kumukuha ng mga specimen na yun, dinadala sa main hospital. So yun yung downside ng LTAC namin. Especially during emergency cases na kailangan mo malaman kung ano yung mga lab test ng mga pasyente. It will take time kasi kasi yun, tatawag pa ng courier para kunin yung specimen. So, yun yung sana meron. But we have radiology, pero hindi rin siya automatic. We have the portable x-ray machine. So when we need an x-ray, we still need to call the x-ray department para may pumunta sa LTAC na x-ray technician para kunin yung x-ray ng patient. So we also have like a small OR kasi nagumagawa din ng mga like tracheostomy, and then yun lang naman, trach, and then peg tube insertion. Doon na usually ginagawa sa LTAC. Kasi nga may mga pasyente na dumadating na intubated pa, so and then hindi ma-win-win. So, di ba, hindi naman long-term yung ED. So, they do a tracheostomy sa mga for long-term na kailangan ng oxygenation ng pasyente mo. So, ginagawa na rin yung trach sa facility namin. If I'm missing something, if you have questions, feel free to ask questions in the comment section. I'll try to answer your questions. Okay, number 5 question. Is LTAC a nursing home? No. Kasi long-term acute care, no? Parang ano siya, di mo malaman. Long-term, tapos may acute. Di ba parang contradicting? Kasi pag sinabing long-term, matagalan, iisipin mo talaga yung mga nursing home, skilled or SNF, skilled nursing facility, or rehab. But we are not like that. We're like in between, no? So, LTAC yung in between nung hospital, traditional hospital or acute hospital, and then doon sa mga long-term cares talaga, which are the nursing home or palliative hospice care or SNF. Yeah. So, kami naman, approximately the patients stay 30 days. Usually, 30 days lang sila nag-stay sa amin before they go to another level of care. Sometimes, pero may mga pasyente na tumatagal, minsan naman may mga lesser, but approximately it's 30 days stay. Yun yung LTAC. Okay, so hindi siya nursing home. Kasi sa nursing home, parang wala atang doctor 24 hours sa nursing home. Talaga ba? I'm not sure ha. Correct me if I'm wrong. But in LTAC, we have a 24-hour doctor, 24-hour nurses. So, kasi kailangan talaga, the patients are not really stable. So, kailangan pa rin nila ng close monitoring. Long-term acute care hospitals are uniquely designed to provide care for patients with complex medical needs. So, kumbaga ICU pa rin na maituturing yung LTAC. Number 6 question. Is LTAC like a hospice, say for a fatal disease such as cancer? No. So yeah, we accept cancer patients, but not because of their of the cancer. Usually kung ano yung complication ng sakit nila, like nagkaroon ng complications sa respiratory system nila, so kaya nag-require ng ventilation, kaya kailangan nila ilipat sa LTAC. So kasi kailangan nila ng specialized care, not because of their cancer, no? So halimbawa na-treat na yung respiratory issue ng pasyente, doon na magde-decide kung ililipat na siya ngayon sa ibang level of care. Like sa hospice care, usually, di ba, sa mga hospice care, yun yung mga nag-aantay na lang. Palliative care, kung ano na lang yung, kung in pain yung pasyente, bibigyan mo ng pain meds, that's palliative. Pero, ano na, hindi mo nagagamutin talaga yung pinakasakit ng pasyente. Parang hindi nagagaling kung gamutin pa. Number 7 is, do LTACs provide emergency room service? No. It depends on each hospital, but usually not. So wala kaming ER. So halimbawa may mga emergency cases naman. Halimbawa one time nagkaroon, parang may hinimatay ata na malapit sa hospital namin. Tumawag yung supervisor ng ambulance and then dinala sa main hospital. Kasi malapit lang din naman yung main hospital. So number 8 and last questions, are there outpatient? We don't have outpatient sa aming LTAC. So we only have yung naka-confine na yung mga pasyente, yung mga confined patients na ngayon. So sa amin usually we have the pharmacy, but the pharmacist is only available at 7 in the morning to 10 p.m. during the weekdays, and then during weekends I think from 7 to 3 p.m. So in cases na may mga gamot na wala sa Pyxis or na hindi available sa LTAC, what we do is we call the pharmacist from the main campus and then papakunin namin ng courier. Yun yung sistema. Usually naman piniprepare na yan ng pharmacist before sila umalis. Nakalagay na yan sa Pyxis or sa the fridge. But syempre may mga emergency cases na kailangan mo ng certain gamot na hindi available, or may nakalimutan, or may nawawalang gamot. Syempre kailangan mo tumawag ngayon ng pharmacy sa main campus para pakuha mo ngayon sa foyer. Sa ground floor nandun yung cafeteria, tapos sa second floor yung pharmacy, sa mga offices, and then the third floor nandun yung minor OR, nandun din yung rehab center. So parang meron tong gym na yun sa mga pasyente na kailangan ng rehab, meron silang doon. Maganda yung rehab team ng LTAC namin. Kompleto kami sa mga speech therapy, occupational, mga physical therapy. Ayan, so that's third floor. Fourth floor, nandun na yung aming regular floors. Fourth floor and then the fifth floor. Fourth floor, usually yun yung nilalagay yung mga less yung acuity ng care. Usually nandyan yung mga wound care or antibiotic therapy na nilalagay nila sa fourth floor. Nilagay din nila yung COVID area doon. Yung kalahati ng fourth floor, sinara nila, ginawa nilang COVID area. But right now, tinanggal na nila yung barrier doon kasi less na yung mga COVID patients namin. So, closed door policy na lang talaga pag may airborne or kung may COVID yung pasyente. So, kasi naman 1:1 naman yung room namin. 1 patient per room. Wala kami nung mga 2 or more. So, the 5th floor naman, yun din yung regular room, and then nandun yung blue zone nga, like 6 rooms for the blue zones, and then the special care unit or yung pinaka ICU namin, which has 4 beds, 4 bed capacity. So that's all I can say for now about LTAC. If you have questions or kung sino man yung nag-work din sa LTAC, please comment naman kayo para mag-share tayo ng mga let's share our experiences with LTAC. This is actually my first experience here in the US LTAC. So at first medyo struggle talaga. Well, I've been there for more than 2 years na, so medyo kahit papaano medyo gamay mo na yung work, pero in general hindi madali. I don't know hindi madali yung LTAC. Yeah, it's not easy, but it's work. Wala naman siguro madaling work talaga. So if you have any suggestions, feel free to comment down below. Don't forget to subscribe, and have a good day, everyone.